If you just slump down and just round your back like you're on the computer, take the biggest breath you can there. And you'll see that you can't take a very big breath. Can you turn your head as far as you can? And then I say slouch and turn your head as far as you can. And you'll see that you can't really turn your head.
So Dr. Kelly, we had just discussed about your book which was desk bound and also the sedentary lifestyle which has been happening due to the modern culture and the modern work requirements. So one of the core reasons I wanted to deep dive was the posture. There is a lot of posture, poor posture with respect to the workstation and the desk boundness. So I want to know what we can do for this poor fracture. There is a lot of anterior flexion, there is a lot of back pain, there are a lot of people who are complaining constant chronic back pain in our practice also and also in a generalized manner also, irrespective of their age. Even there are patients which are 21, 22 who have just started off with their careers and they are experiencing severe back pain for the same. So I want to know more about this back health.
If we take the word posture, the Latin root of the word posture is just position. That's what it means. It means position. What we can hint at is there are good positions and bad positions. No, there are positions that allow me to access my physiology. So here's a good example. If you just slump down and just round your back like you're on the computer, take the biggest breath you can there. And you'll see that you can't take a very big breath. And if I say, can you get yourself into a position where you can take a bigger breath? Everyone will automatically pull their rib cage down, their head will come up, and they can take a bigger breath. So instead of saying to people, let's try to get into this position, like it's some kind of, shavasana, perfect pose. Instead I say, well, can you take a maximum breath in that position? And what we see is that people know how to self-organize based on their bodies and their experience to be able to take a bigger breath. So one of the things that we can have people do is quickly sort of self-test. Is there a shape I'm in that allows me to get a bigger breath? And what you'll see is that people scoot to the edge of their chair, right? They hint at finding positions where they have better access to their physiology. So again, it's okay to slouch, but not all the time. It's okay to be overextended, but not all the time. I need to use my spine the way it is. If I have you say, can you turn your head as far as you can? And then I say slouch and turn your head as far as you can. And you'll see that you can't really turn your head. So once again, we can hint at, well, this position where I'm better organized and can take a better breath transfers into better function and better physiology. We would like people to, number one, if you are finding yourself at a work environment where you have to be sedentary, and that's a lot of us. We just can't get around it. I'm talking to you, but I'm actually perching on a stool. So my feet are on the ground and I'm leaning against the stool. And so if I'm sitting on the stool with one leg off, now I'm back to sitting on the ground with my legs on the ground, but I'm not using the back of the chair, but I'm still sitting, but I'm engaged in positions because of the environment that allows me to maintain access to my physiology. In this situation, I can take a bigger breath in this position. I can still rotate in this position. And I'm having to use more musculature to keep myself upright. And now my hips and my femurs, my leg bones and my pelvis are having to have a more sort of meaningful relationship than if I just sit on my butt and my legs do nothing. Well, one of the things we can say is, well, how can I change my environment? And sometimes it's nice to stand. So now I'm standing, right? Sometimes it's nice to perch, again, having access to a high stool. And then what ends up happening is that I want to give myself choices to fidget. I want to give myself choices to stand up and move around or take a little break or move my body a little bit. But what I do when I sit down is I start to close off all the movement options because I can't really do that many things when I sit down. But as soon as I'm in an environment where my posture or my positions are starting to cause me discomfort, what we want to say is, well, are there positions and shapes that allow me better access to my body's natural abilities? So perching against a stool, again, sitting isn't bad, but if that's all I do for more than 6 hours a day, it's going to be a problem. And more importantly, if I sit down, I may have fewer movement choices.
Dr. Kelly, you just mentioned the preventive measures for avoiding poor posture for chronic reasons. Now, what happens if there is a person who is coming to you and he has a poor posture ingrained in his personality? How you should correct it? Means what are the interventions you provide so that his posture, which has slouched into his personality, you have to straighten up with the help of the exercise interventions. I want to know more about that.
Well, you know, it's so great. I love that you said integrate into your personality. And I think that's a really nice way of thinking about it's a snapshot of how we've trained our bodies to be. So if you work with someone who does yoga or is dancing, they have a beautiful carriage, their spine is long, they just are, I'm like, I want to look like that. And then someone who's been on a computer all day long, right? I don't want to look like that. So if we look at the body's shapes and positions, one of the things that we forget is that movement is a behavior, and behaviors are learned. Behaviors are reinforced. So who I am and how I work in the world is really just an expression of the shapes I adopt the most time. The question is, how am I going to reinforce or rewire someone? When your auntie or grandma told you to stop slouching, did it work? No, it didn't work. It never worked. So yelling at someone to stop slouching, like it's impossible. What we have to do is change the environment, and two, train the body to find more effective positions. And that's why there's yoga, and that's why there's Pilates, and that's why there's modern strength and conditioning. And it's interesting that all of these physical practices all are based on having a spine that's dynamic, that can move and twist and rotate and flex and extend, but that is usually in its lengthened sort of longest position. And so when we put people into that training over time, we will see changes in the reflection of their personality through their posture, as you said. And then sometimes, you know, if I get stiff because I hang on the meat of my back, I may have to lay on something like a roller to get things moving again, so that my brain says, oh, this is a possibility of moving differently.
दोस्तों, ये वीडियो अगर आपको वैल्यूएबल लगा तो इसे लाइक कर अपने सारे दोस्तों से इसे शेयर कीजिएगा. इस चैनल को सब्सक्राइब तो आप कर ही लेंगे. चलिए मिलते हैं.